Hi guys, welcome to Fit Dads UK. I've not introduced myself properly yet. I'm a physiotherapist. I've worked as a physio for 10 years, so as part of this channel I'm going to do some information videos, I'm going to do some stuff that's going to help you out with certain conditions and injuries and stuff that you might commonly come across. So today I'm just going to talk a little bit about knee pain. Alright, so let's get stuck into the video. Hey everybody, welcome to Fit Dads UK. Today I'm going to do a video about knee pain, particularly anterior knee pain. So anterior just means front of the knee, so we're talking about your kneecap. So I've had one request to do a video regarding a clicking knee. So the knees don't always click, but obviously they can still cause pain even if they're not clicking. So what can cause these issues? Your kneecap itself tracks within a groove. So this groove is actually on the end of your femur. So you can see by the graphic I'm going to put up now, it shows you how the kneecap actually moves. So you can see here, the kneecap's tracking and pulling into this groove, and then as you straighten your leg, it comes out of the groove again. So that's why when your leg is actually straight, you can physically move the kneecap around more. When the knee bends, it's more difficult to move that kneecap, and that's because as it's bent, it sits into the end of the groove, which is on the end of your femur, which is your thigh bone. So the problem often arises from how this kneecap makes its way into the joint, as it were, into the patellofemoral joint. So your patella is your kneecap, femur, so patellofemoral joint. That can be caused by numerous things. Sometimes the groove where the patella lives is a little bit shallower than some people. So it can be quite deep or it can be quite shallow. That can cause an issue sometimes because if it's deeper, then it kind of grabs hold of that kneecap more efficiently, and it can get into that joint better. If it's shallower, there can be a tendency sometimes for it to deviate or move out of the sides of the joint. There are other things that can make that happen more readily. For example, muscle imbalances. So muscle imbalances tend to occur in the thigh, in the quad, and also around the hip. They're the main areas that are going to cause this problem in the knee. So what quite often happens is we get an imbalance where we get an overworking lateral part of the quad, lateral meaning outside, and the inner medial part of the quad isn't working enough. So this particular muscle here, which again I'll show you on the graphic here, is called the VMO. So that means vastus medialis oblique. The important part of that name is oblique. What oblique means is people probably have heard of obliques in the abdominal area, if I can talk. That's because they kind of go in an oblique or diagonal direction. So it's a similar thing here, where the oblique goes in this direction and grabs hold of the side of the kneecap, as it were. All the other quads are sort of going up and down because that's the direction that they contract and move in. This VMO is obviously very important because it has this effect where it almost gets hold of this kneecap, holds it in a good alignment and position, and then when the rest of the quads are contracting, that helps obviously make that joint move better. So that's the first area of muscle imbalance that can cause a bit of an issue. So the first port of call is obviously to have a look and see, right, have we got tightness here? Is there something we can do to release this tightness in this area? Also, is this muscle working well enough? Does it feel like it's physically contracting when we actually do a lunge or a squat, for example, or if we just do an active extension of the leg? Can we actually see and feel that contracting? Because there's ways that we can obviously stimulate that to happen more. Secondly, as I mentioned, is the hip. What can commonly happen with the hip is naturally, I don't know if you've ever seen a skeleton, but if you had a model of a skeleton, for example, if you hold it up and then you sort of let go of it, what happens with the legs? The legs tend to want to do this. So it's the muscle system which holds the legs outwards. Without the muscles, the bones want to do this. So what happens is, particularly with running, and this is a common problem that people come to me with and they say, I've started running, or even I've been running all my life and it's just started to cause me a problem. Also, because we sit a lot, we're going from one extreme to the other. We're going from sitting down all day and not really moving much to jumping into activity, whether that be just running or playing football or whatever other sport that we do. So what can happen with running in particular is when your weight transfers onto one leg, this leg, as I said, naturally wants to sort of deviate inwards. So the muscles that counteract that internal rotation of the leg are your external rotators of the leg. And the leg is rotated from the hip. There is some twist and rotation in the lower part of the leg, and you can see if I keep this part of my leg still, we can still sort of rotate the lower part of the leg. So there is some movement in here, and also the foot can play an important part. So that's something else to consider. But concentrating on the hip first of all, external rotators externally rotate the hip. So if we strengthen the external rotators, that's going to play an important role as well. So this particular problem of internal rotation is more common in females because females' hips are slightly wider than males, so therefore they've got a slightly increased what we call a Q angle. So the Q angle is this angle from where your upper leg hits the knee, and then obviously the difference in that angle there is what we call a Q angle. So whatever that angle is, that is less with a male naturally. So we tend to get a little bit less problems with this internal rotation. That's not to say it doesn't happen. So first protocol is obviously to strengthen the external rotators. So obviously I can show you some exercises which will help to strengthen the external rotators, and we'll go into those at the end of the video. So the other thing I mentioned was the foot. Structurally, people can have a lower arch, a medial arch, so what we call this part of the foot. So what that means is the foot goes flat, and people say they're flat-footed or overpronated. A natural amount of pronation is relatively normal, and a lot of people will talk about this as if it's a big problem. It's not always the case. You see a lot of world-class runners who run long distances who overpronate a lot and they don't really have any issues. Successful runners have got this overpronation problem, so it depends on the other biomechanics in your legs, and it's something that probably needs looking at as a whole, as a holistic assessment, whether that's watching you running on a treadmill, watching you walking. That sort of thing does need a professional opinion, and it's probably too much to go into on a video, but it's something to bear in mind, and it's something that can be easily helped with. For example, if your footwear and your trainers are poor, if your foot's landing and your feet are falling inwards, what happens to the knee? Your feet fall inwards, the knee internally rotates. So this again is causing this issue. This knee wants to be pointing forwards. That's going to give the best tracking and the least amount of excessive lateral loads, sideways forces through that kneecap, through that patellofemoral joint. If we can keep that nice straight alignment when we're running, push through in a straight line, that's what we want. So, easy fix if you've got poor trainers that are collapsing in, can we get a trainer that supports the medial arch better? So that's the first thing to think of, decent footwear. Day to day even, if we're walking round and we've got these fold up shoes that you see that people could put in the pockets, no good. So I've walked behind lots of people and seen these and thought they're terrible, the feet are turning in, it's not going to help with knee pain. So if you're suffering with knee pain, decent footwear. So what I'm going to do in the second part now is, like I said, I'm going to show you some exercises to help to release tightness and tension in this lateral part of the quad, strengthen this VMO or this medial part of your quad. Also looking at some hip conditioning stuff, so to try and work these external rotators, and also just release any tension in the front of the hip or in the internal rotator that might be pulling this hip down. So let's get into some exercises. So first of all, we'll start with the basics. So to stretch and release tightness in a lateral quad. So simple quad stretch. The mistake that people make, they let the knee come forward too much when they're doing a quad stretch. We're not really pulling into the top of the thigh there. We need your knee to be at least next to your standing leg, or preferably behind it a little bit. And then also what can happen is when we do pull the knee back, because of tightness, people tend to lean forward. So make sure you've got good posture, good alignment, you're nice and straight, get that knee back. If it's a bit too tight, obviously you can just take a little bit off the knee, but if you can get that foot up more, then obviously do that. Take your time with it, don't be too forceful, give them tissues time to respond over a few days, even a couple of weeks. If you're quite tight and only just started doing it, give it time, yeah, don't force it. What you can also do as well is, you can bring your other arm to hold that knee. And what that will do slightly is it'll just emphasise the lateral part of the quad a little bit, because we're pulling across a little bit more as opposed to pulling straight back. That'll just pull into that outer part of the quad a little bit more. Another way you can do it is with a hip flexor stretch. So you can do this just leaning forward. Again, if we lean the body forward too much, we're not going to get too much into the hip flexor. We're just really doing a lunge for this standing leg. So what we need to do is obviously shift that weight, body weight back a little bit and lean back into this hip flexor. When you're standing and you're not putting your knee down on the floor, you are going to be getting activation of this quad. So it's difficult to stretch and release whilst getting activation, whilst using the muscle. You're stretching your hip flexors a bit more passively, but not so much into the quad. So what you can do is you can rest that knee down, and obviously try and do it on a bit more comfortable surface than this floor. It's not going to hurt your knee. Just use on a carpet or on a cushion or something, and then just trying to sort of lean back into that knee a little bit. So that's probably 2 easy exercises you can do to try and release this. Another one would be lying on your back, hanging a leg back off the side of a couch or on the side of a bed. I personally think those 2 first ones are perfectly fine to use. What I would also do is simply massaging into this leg. Can you find anything that feels tight? And sometimes when I say this to patients, they look at me and think, well, I'm not a physio. It doesn't matter, as long as you can feel something that's tight, and maybe you're only getting this problem in one knee, maybe you're getting it in both, you might be able to tell the difference, but if you can feel something that's tight, try and just work into that. You can do that just sat down in a chair. Just try and regularly just work into it and see if you can loosen that off, and then your stretches should hopefully be better for you. They should feel easier to do so. I would recommend doing those three things really. Stretching the quad off here, stretching your hip flexors, and also just try and do a bit of soft tissue release. Okay, and for the hip, so we're talking about trying to strengthen the external rotators to stop this internal rotation motion happening when your weight is transferred onto your foot and your body wants to collapse in this way. So I think a really good one for this is using some resistance bands. I've just attached this to a handle here on the doors. A little bit high, but it doesn't really matter too much as long as it's pulling this way. So you want to do it sort of, attach it knee height if possible, round the table leg, trap it into a door. If you tie a knot in the end of it, swing it, trap the door on it, shouldn't go anywhere, especially if you put it on the hinge side of the door. So what I'm going to do is obviously put this through and around. With these bands are quite good. You can get the bands that are quite narrow, or these are quite wide. These you can just spread them out around the joint a little bit, and they tend to sort of stay in position a little bit better. Again, this is a tad high, but it'll still work. So, just to show you for effect, this isn't physically pulling me over too much. A harder band is obviously going to challenge you more, but what this is trying to do is it's trying to bring my leg into this poor position that we don't want. So I'm having to work even harder to get that back where I need it. So rather than having no tension pulling on my knee and just trying to do a sort of lunge exercise, now I'm having to work a little bit harder. So obviously we're going to challenge the muscles which externally rotate and track that knee out into good alignment. We're going to challenge them more, yeah? We're going to get a little bit more sort of strengthening work going through those. So simple as just doing a sort of lunge exercise. So coming forward and controlling that knee. Really try and keep that knee pinned out. Even if we overemphasize it a little bit and try and bring that knee out a little bit more as we're doing that lunge, feel it up in the glute and the outside of the glute there as best as you possibly can, okay? I'll do these on both sides just to keep balance, also just to give you your rest period as well for the other knee, yeah? Generally, obviously, you've got the 3 sets of 10 which everyone uses. You want fatigue to be happening. End of the second set, the last couple of reps. End of the third set, the last 3 or 4 reps. You want to be feeling like it's getting a little bit more difficult to do. So really good exercise to do. And again, to flip it round, you can keep the band facing the same way, turn your body around, attach it through that leg, and obviously repeat the reps that way around. So another one that's going to work the external rotators and your extensors as well is if we use the same band. Again, I would do this slightly lower. Oh, this is my fixing point. And then, like I say, because this band opens up, you can get it round behind your heel. So what you do is you get it round, back of the heel, and then we know it's not going to move anywhere, yeah, because it's wrapped around your heels. I'm going to go sliding up your leg. And then what we're trying to do is we're trying to, I'll show you this way around just so you can see, rather than going straight backwards, we're trying to go backwards and externally rotate the leg. So if you play football, you'll probably understand it'd be almost like you're preparing to pass a ball, you're opening your leg out. Obviously we're doing that against resistance. I'll show you this way, show you that way so you can see what I mean by the leg. So when we pull back, we're not just going straight back and we're not leaning forward too much with the body. So try and keep the body upright and then we're externally rotating. And this will work the standing leg as well. Keeping your balance, which is difficult in itself. But again, it's going to challenge the muscles. And a lot of these muscles around your hips and your glutes are stability muscles. They're not designed for large movements. A lot of them are designed for stability. Your glute max is a big driver, obviously, when you're running and doing other stuff, lifting, pushing. But simple as that, okay? And again, I'll repeat it on both sides and put that onto the other leg, but you get the idea. So that's a good standing. And you'll notice that these exercises I'm giving you, the functional and the weight bearing, the standing. I'm not giving you lying down clam exercises where we're just isolating the glute, because yes, they do isolate the muscle, but how functional and realistic are they for running, for football, for other activity? In reality, they're not. And I think it's much better to do more multifactorial exercises which bring in lots of different muscles as well, and obviously use the different muscles that you're going to be using in your particular activity that you do, like running. So I think the standing ones are much better. So guys, there's some really good exercises. We don't need a lot, and ultimately you just want 2 or 3, 4 exercises which are really going to help you. What I tend to do is give people maybe a few more at the start, get some feedback from them, and they come back and say this one doesn't really feel like it's doing anything, or I'm not keen on this one's great, and we end up with, like I say, 3 or 4. The reason for that is you're more likely to do them, they're more manageable to fit into your day, and you just get a better buy-in from people if you just got 2, 3 or 4 really good ones that work for you. They hit all the areas that we need to hit, so we don't need to do any more than that. One thing that I would say is when I say to people, if they're here because of pain in the front of the knee, if you're feeling pain, then when you're doing, for example, a lunge, don't go down too low. So if you start to feel a little bit of discomfort at this range, we just go to that range. Yeah, we just touch on the discomfort as we get into it and then come off it again. It's a subjective measure, 3 or 4 out of 10. I usually say 10 out of 10 is a fork in the eye. People normally not drop down a couple of scores there, but I mean 3 or 4 out of 10 is a mild discomfort. You're not grimacing. It goes away pretty much as soon as you come out of it. The idea is that we get a little bit more range, we get a bit deeper with the exercises as we progress. If we go too much too soon, there's a potential for you flaring up tissues, the cartilage, any other things that are getting inflamed in there, and bursts and stuff like that. So we don't want to do too much too soon. So take it easy, just control your range and even your reps. If it means dropping down to 3 sets of 6, 7, 8 initially, do that, and you can build it up as you get a bit better. So thanks for watching everyone, I hope it helps. Any questions, stick them in the comments underneath. I'll try and answer them as quickly as I possibly can. I will be doing more videos like this in the future for other common issues that people will get, as well as the knee. So yeah, look out for those. And if you've not already subscribed, hit the notifications bell, and obviously you can stay informed for any future videos. Other than that, take care guys, and remember, who's the daddy?